Hello, everyone, and welcome back. Today we are talking about Mitchell. Ta-da! And how he's doing since his dental implant surgery. Let's see your smile. It looks nice.
It's getting better.
Yes.
I can actually. I'm
Smile.
not so swollen. I can actually smile.
So Mitch was just telling me a few things, and I needed him to stop so we could record this so we can remember. And I'm sure a lot of you have questions about the implant surgery process. So Mitchell was telling me that he didn't know a lot about what was going to happen, other than they're going to take the top teeth out and put the implant in, and they've got to file down little stuff and blah, blah, blah. And, there you go. Do you have any questions? Well, we didn't know what to ask, right?
What are you going to ask? You're going to take out the old teeth and put in new ones.
The ones that are running. And you found out a lot of stuff about the infection. So tell the people what you found out the day before your surgery.
The day before. Okay, so the day before, they sent me this, basically a text in their little app. And it said, okay, you have to, obviously sign all this paperwork to cover their butts so that I can't sue them for anything. And you need to be quick because if you take longer than 10 minutes, it will kick you out and you have to start all over again for your privacy. I don't know how that helps your privacy to kick you out in 10 minutes or you have to do it all over again. I'm not going to get up and walk away and leave it somewhere where somebody I wouldn't want looking at it would be. I'm not leaving my phone at a restaurant countertop. But anyway, so under pressure to read all 8 pages of paperwork, fine print stuff.
Really fast.
And I'm noticing as I'm reading, it's telling me aftercare stuff. I'm noticing as soon as I sign it and move on to the next page, that page goes poof. I don't see it anymore. But I thought, well, maybe there's somewhere in the app where I can go back to it or something. So I did. After the third page and taking 8 minutes, I was like, oh, I better hurry. I don't want to have to go through this again. It was taking forever just to scroll through. So, but anyway, I'm skimming, I'm hurrying, and it says okay, just so you're aware, they're taking all your teeth out. You will be toothless. And I'm like, oh, that doesn't sound good.
And they're gonna grind
but I was aware of that.
Palate.
And then they've got to, they got to grind down your palate.
The roof of your mouth.
The roof of your mouth. So that helps the piece fit in better. I guess otherwise it would stick down too low and.
But you had no idea.
But at this point, yes, until this point, I had no idea. But
your surgery is the next day.
You told me this, and so I initialed that. Okay, they made me aware that this is going to happen.
That second.
But at the same time, I was still I don't know if that's really for my case or is that for people that are worse off. Apparently, I'm worse off.
So they ground down or filed down your palate, which is why you're in so much pain.
Because what I knew is they're going to take out all the top teeth. Okay, I've been
But you thought they were just going to pull them out.
And then, I asked the lady, is that what they do? Do they pull them out with pliers? And she said yes.
She lied.
But, we suspect that wasn't entirely true. But maybe she doesn't know.
Maybe.
I don't know. I'll give her the benefit of the doubt that she just doesn't know. But
I asked if you could get your teeth, and they said they don't do that.
They won't give me my teeth. Candy suspects because they just cut your gums and then just
saw it right out.
Grind them right off.
Yeah. I'm wondering if they cut your gum and kind of just fold it back. Kind of like when they do the surgery, they just cut your skin, fold it back and get in there and then pull the skin back down and sew it. So I'm thinking they just cut your gum, cut it away from your bone or your teeth and pulled it up. Yeah. I know, which could possibly be why you're in so much pain.
What I was told in person beforehand was, okay, they'll take the teeth out and then he'll smooth down your jaw. Because I was worried when I've had a tooth pulled before and like little slivers break off of your jawbone and they work their way through your gums and it's really annoyingly. I mean, it hurts, but just in an annoying way. It's not horrible, but and I've had to like dig and pull the bone pieces out with pliers before just to get relief. And but yeah, they said that shouldn't happen because he's gonna go in and smooth your jawbone. But what they don't say is he's going to go and grind your jawbone down so that it's smooth with like a grinder, like a Dremel. Yeah. And yeah, let me tell you right now, that is painful. Also,
you were asleep.
Fun fact, in their paperwork of their aftercare that they gave me the day after my surgery.
So you didn't have it when you went home.
It is normal to experience some discomfort. It's one thing that very much annoys me. I like this place, and this was a necessary thing for me, I feel like. We did go over many different things, but they minimize completely how bad it hurts. They gave me 3 days, was it 3? I don't remember. They gave me half the painkillers I would have been preferred to have for the amount of pain I was in. After my painkillers ran out, I still had at least like 2 really hard days doing Tylenol and ibuprofen.
And still in pain.
Like the max amounts you can have and agonizing pain. And I call them up. It's been a week. Is it normal to be so sore and swollen and really hurting? Oh yes, it's normal to experience a little bit of pain. I wanted to scream at the lady.
A little bit?
I am in agonizing pain. This is not little. It's now been 2.5 weeks. And it still is swollen. Not nearly as much. I can
rate your pain from the day that all the numbing wore off. Let's say 3 days after surgery when it's definitely no more numbing there. Or 2 days after. What would you say on a scale of 1 to the highest pain? 10 is high. Let's just say 10. 1 to 10. Would you say it was a 10? And then numbing wore off? Or it was worse than the worst pain you ever felt?
It's hard to say because I still had painkillers that day, but that was definitely the worst day of my life.
Okay,
that was the worst I have ever
let's say it was
felt.
the worst. It was a 10 with, but you were medicated, and when the medicine was wearing off, the pain was so strong it was a 10 till you got more medicine.
Yeah.
Now you're just with Tylenol and ibuprofen.
And I've been doing Tylenol and ibuprofen for over a week, like a week and a half.
So 1 to 10. When your medication's wearing off, do you feel like your pain's a 2, 3, or 5, 7? So bad.
Up until 2 days ago, it was still like an 8.
So pretty intense.
When the Tylenol and ibuprofen would wear off.
What makes it worse? The pain worse. What makes it worse?
Talking.
Eating?
And eating. Eating, oh yeah. I can't, they say not to eat anything that you can't easily cut with a fork.
Right.
But honestly, if I try and chew anything that is any stiffer than like mashed potatoes, that puts up any resistance, it hurts on the roof of my mouth. Does it push
the implant into your stitches and cut gum?
It's like it's pushing, it's like if you had a broken bone and you're sitting there pushing on it. That's what I've said. It's like I've got a broken bone in my roof of my mouth. Yeah. Which I don't know where they did the bone graft exactly.
Because they did a bone graft. We didn't tell them that.
Bone graft, yeah. So
they took blood before your surgery.
Is like having a broken bone.
But they took blood before your surgery in case they needed to do a bone graft.
Yes. Somehow they use your blood to do the bone graft.
So
and I wonder if he actually didn't know he needed to do it
ahead of time, because he said that once he got in there, it was so infected.
Yeah. So I had a couple of really bad teeth on this side, and he said it was so infected, like the jawbone was just like liquid.
Like under your
gums. So he had to like clean it all out, and they had to do a bone graft there, and I don't know if they had to do a different bone graft somewhere else. If not, then I think he knew how
bad it was from the X-ray.
At least to some degree from the X-ray. Which they did not make that super clear. They didn't say, "Oh my God, you're super infected. We're gonna have to."
You're infected, honey.
They did make it clear that they do a bone graft sometimes, but again, I'm like, well, that sounds like worst case scenario.
That's the other people, not you.
Apparently, I was pretty bad off. But today, well, in the last couple of days, I've been trying to go longer between taking ibuprofen and Tylenol. And I've even done a couple of days I went without the Tylenol during the day. Just because I felt like I needed to give my liver a break. Because it was getting tired of so much Tylenol day after day. So I was able to do that, but I could not go without the ibuprofen. But lately I've been trying to go longer without the ibuprofen. Like, okay, I could have more at 5 o'clock. It's now, I'm pushing it to 6, 7, 8. So today I've actually, my ibuprofen wore off at 5 and it's now 8:25 and I'm not in horrible pain. It feels more swollen than it did 4 hours ago, but not enough to be super painful. Also, as the swelling's going down, it's going from like, oh, my whole mouth hurts, to, oh, I feel little spots where it hurts, like where they drilled the things or something. It's like, but those bother me just as much as, oh, my whole mouth hurts, because you notice it, I guess.
I have a question.
Mm-hmm.
So eating and stuff makes it worse. What?
Yes. And it
helps
really irritates it.
Besides the medicine, is there any other thing you can do to help
That was one thing I remember.
Feel better?
Cold helps. The problem is like or in the beginning when I was doing ice chips, I got a blister on the roof of my mouth. And I think that's because the ice chips, while cold, are kind of rough. So squishing them against the roof of my mouth gave me a little blister. But I do wonder, Candy made some ice cream, and I remembered that just a little bit ago, so that would help. The best thing to do is just eat. Your mouth gets irritated. Well, eat without chewing. Your mouth gets irritated, and then rinse with the warm salt water.
What about the washcloths that you've been doing? Does that seem to help with the warm?
I haven't done that in a while. Maybe that would help.
Because you was doing warm compresses, like washcloths goes out and then placing it around your mouth. Did it help?
Yeah. It definitely helped, like, relax it. Which, a lot of my trouble today has been the muscles right there, I think from talking and chewing. I don't know. But they're very tight. And that almost, it can get so tight that it hurts. It's not really hurting just yet. But.
So, if by some weird chance...
2.5 weeks. I thought I'd be, like, feeling fine, going out, doing things. My dad invited me fishing, and I'm like, maybe next week. And we have an appointment to go fishing later this week. And I'm like, I hope I feel better. At least more than I do today.
If for some reason these bottom teeth just, whatever, hereditary genes, nothing to do with you, got really bad and you ended up losing them and you just got those 2 implants there, would you just chew with those 2 teeth? Or would you...
I don't know if they could give me some kind of like a partial thing.
But you wouldn't get implants again knowing what you know now, or you would still do it?
If it was in like 20 years...
And you forgot about it?
I might be willing to try it again, but as of right now...
Is it because you're in pain?
This has been one of the hardest... Recovery has been one of the hardest things. And here's the thing.
What's the thing?
I'm 2.5 weeks in. At 6 weeks, the bone graft or whatever is healed, and I can go in, and then... I don't even remember what they do. Basically, I'm allowed to drink through a straw again, which... You don't know how much you like drinking through a straw till you're not allowed to do it. I got so sick of my big cup trying to drink out of it. I've been drinking out of just these bottles lately, just refilling them in the fridge because I got tired of that. I have a big mug that I fill with ice water, and that just got annoying. I have a favorite cup, and it has a silicone straw. And I really wish I could drink through that.
Do any of you guys have a favorite cup? Or is it just Mitch?
I went with my big mug, and I one time, luckily only once, I banged it on the teeth. Oh, my whole head shook. I was like, oh man. And I thought, you know what? That wouldn't have happened on my silicone straw. But
That's true.
I don't know. I thought where they sew it all up,
It'll be fine.
I swear he told me that the first day, that where they sew it all up, you can drink through a straw. But everything they've said, do not drink through a straw for 6 weeks. But then also, it's not fully healed for 6 months. I have to eat basically baby food consistency foods for 6 months. And I didn't think that would be a big deal. So far, it's not enjoyable and is kind of miserable. So I don't know. Yeah, I don't know. I thought, oh, surgery, I'll feel crappy for a week. No. This has been really hard.
But you look great.
I don't want to do it again. But, yeah. I wouldn't have done it just for looks. I did it so I can eat stuff, like...
I think that it was a blessing that you chose to do it because of that infection in your mouth. We might not have known.
That could have been... Had we waited to do anything, and... Yeah.
I mean, it could have went and turned septic, could have went to your heart, anything.
And anything else I would have done would have left these teeth in jeopardy of me losing them as well. And so having all this is
saves
gonna
all
save
your teeth.
all my bottom teeth. Otherwise, I'd probably be losing them as well. And that's why this was the best option for me. Because basically all my top teeth were compromised in one way or another. Several of them, were
way
really
worse
bad.
Than you thought.
And even the ones in front that weren't too bad were wearing down and had fillings, and some that had fillings and had fallen out and were even hurting now. But
so when you came home from the hospital, were you treated good by your family or were you treated really badly? You could be honest. I'm not holding up a gun or a knife or any kind of weapons threatening you.
Could have been worse.
It could have been worse. I'm sure it could have. I could have not fed you.
I could have went for more massages.
How many did you get?
0. They gave me no massages. Oh man, the fact that Cody even was kind to me in her speaking, and I think she gave me like a pat, not quite a hug, but like a pat, and that's pretty good for Cody. And then
because she's a teenager,
gave me some hugs and was pretty nice and made me a bunch of I'd be 10 to 20 pounds lighter right now if it wasn't for candy. So
I feed you?
Bought some good food. Yeah. Way softer. So I don't know if they know, but Candy was just gone for overnight. And, my energy's getting pretty close to back to normal. And so I made, I thought. And then
it's late now.
I made all my food. And having to make all your food and wash all your dishes, I got pretty exhausted that day.
I can't even imagine.
But yeah, I made food, but all the food I made was not as soft and just not as tasty
as what I make.
Yeah.
You mean you have a good wife?
Yeah.
Aww.
And it wasn't as filling, which I don't know. I don't know why, because I felt like I was still eating a lot, but I eat my food, and then I was like, I'm still hungry, but by that point, my mouth is irritated, it hurts, I just want to brush and rinse and call it a day. Oh yeah, you're supposed to brush these, but don't go near the surgical site. That's in my mouth. How do you brush your teeth without... There was so many things that were really annoying to me, and it's not anybody's fault, but there's just I get it's probably a fact of the surgery that, you know, so much stuff contradicts itself. Take it easy, but be active. You know, like
Eat, but don't
things
eat.
like that. Yeah, eat, but don't eat. And keep your mouth clean and everything, but don't touch it. Okay. Yeah. So you're brushing your teeth, trying really
And
hard.
no toothpaste.
No toothpaste for 6 weeks. That is not fun. I did though. I called them after the first week, and I basically begged the lady, please, can I just have a breath mint?
Because my mouth smells like a
said-
dead animal.
They said don't bite it and don't suck on it, but you can just let it sit there, and don't, as it dissolves, don't let any pieces get up under the appliance, because that's what this is. It's in the same category as a fridge.
It's an appliance. It costs more than in a fridge.
Yeah, that's true.
We could have got a really nice one with an ice maker.
It's like your whole house worth of
Appliances.
But yeah, don't let that get up under there, which hope it doesn't matter the pudding gets up under there, because I don't know how the heck you'd eat anything without anything getting up under there, but I think they thought the little chips probably just wouldn't wash out as easy as, you know, soft baby food texture foods. And then you're supposed to rinse, like, after every time you eat, at least. So, I've been trying to do that, keep it clean. But, yeah, just a lot of, like, contradictory things that are like, this really sucks. Not that I thought it would be a walk in the park, but I don't know. I thought 1 week, 2 at the most, and I'll be back to normal. And now we're going on 2.5, and I still got 3.5 weeks until I can drink through a straw. I can't wait till that day. I'm taking my favorite cup with me to the dentist. As soon as they say, yep, you're good, I'm walking out there drinking my straw. Maybe go get a Slurpee.
Oh, yeah.
My body can't handle that sugar.
But something like a Slurpee.
Yeah.
Like a big gulp.
Yeah.
Big gulp. That'll be good.
That's why, for the most part, I've stuck to the keto, not necessarily because I need to. Obviously, I still have weight to lose, but I'm not as worried about losing weight at the moment. But it's just, keto is my favorite foods. I like salty meat and cheese. So that's largely what I've stuck to. And my body doesn't care for the carbs anymore. I tried. I had some SpaghettiOs. Yeah, I was like...
Yeah.
And then I had some tomato soup, and that was even grosser.
Grosser? Is that even a word?
I'm making it a word.
It is today.
It was unpleasant, and so I ended up dumping the tomato soup out. I don't know. I mean, like, you know, SpaghettiOs used to be one of my favorites, but I ate it, and I was like, this is kind of flavorless, and if I'm going to eat something, that isn't even following my normal diet, I want it to be good.
Tastes good.
And it wasn't good, and it doesn't make me feel good, and I want to eat foods that make me feel better, and so mostly I'm sticking to keto, but we're making a soup right now with mashed potatoes in it to be a little thicker, so I'm obviously not like 100% strict at the moment. I'll probably get back, I'm telling myself I'm not going to worry about it like that until the 6 months is up.
Until your body's completely healed.
When I can chew things, oh man, how great would that be? I'm like waiting for them to be like, well, actually, you still have restrictions of what you can chew.
Oh
They said no. They said no. They said I should be able to eat like almonds, and I haven't been able to eat nuts in a decade since I had like a really bad a big filling put in, and the dentist then told me like it's so big you want to be really careful or it could break and fall out. And so yeah, like over a decade, I've been like, oh, I really avoid nuts. Occasionally, I still would eat something here or there. I'm not super excited to like, oh, I'm gonna. But there's like these almonds that I really like. They're like Smokehouse or something.
Yeah, and we usually blend them into a
yeah,
butter.
we blended them into a butter, which is amazing. But it'll be nice to just eat them whole.
All right.
Like, especially if I'm on a hike or something.
Exactly.
You know, just take them and eat a few or something.
Well, getting tired.
Yeah.
All right, guys. I think we're going to go for now. We just wanted to check in so you could see that Mitchell is doing great. Look at he's withering away. Look how skinny he is. I do want to
say, as much as I'm like, oh, this is miserable and poor me, you're welcome to feel bad for me.
Oh, yeah. Oh, you poor thing.
Every day is 1% to 2% better.
There you go.
So
that's all you need.
Improving.
Well, you look great.
6 months, you won't even know I had surgery.
Until you talk about it.
Yeah.
All right. So, if you have any questions, either about the surgery itself or what he eats on keto or any of those things, you're free to leave them in the comments. And either he'll make a separate video for you guys or he just may answer them on there.
Yeah.
Yeah.
Yeah, I would like, if anybody is like thinking about doing this, I really didn't think about it much, which is probably a good thing because one, I didn't have a lot of time with my jaw the way it was. And had I thought about it too much, I probably wouldn't have done it.
You probably would have talked yourself out of it.
Had I researched or, more and been like, oh, this is what's going to happen. Some people that's really good because they need to know going in, and for me it was kind of like, bungee jumping. You just like, before you know it, you're hooked up and they're shoving you off.
Woo!
And I think for me that worked because had I known how rough this was going to be, I wouldn't have done it. Likely, but
everybody's different.
It was necessary and it needed to be done. And yes, everybody's different. It is known in our family that I'm a huge baby when it comes to pain. So I'm sure that there are women out there who would be like, oh, that's not even that big a deal.
Yes, Mitchell is a big baby. Baby.
I like to be 100% comfortable all the time.
And he wants to be babied all the time.
Yes.
He said, I think if, correct me if I'm wrong, but I'm pretty sure you said, I want to be top priority.
Yes.
Over everything.
I was about 85th priority.
No, you were not,
I'm
liar.
Just kidding.
I want to be more important than school. I want to be more important than dance.
Yes.
I want to be more important. Top priority.
That was still during the painkiller phase.
But yes. Still, that's the big baby in you.
I wanted, yes, top priority. Cody loved when I said, I don't think she should do homework the next 2 weeks.
She was like, yes.
She didn't care for the part where I said, and then we'll put her in a corner and she can do nothing but homework.
She's like, no, I don't like that idea. No. All right, guys. Yeah. We're going to go for now.
Thanks for watching.
And we will see you guys in our next video.
Bye.